Welcome back to our show, ladies and gentlemen. Of course, today is not going to be super heavy, but it is heavy. I'm going to say that.
It's not going to be super
heavy, but it is heavy. So we're actually going to be touching a little on diabetes, of course, specifically diabetes in Malaysia. Now, Brendo, you're always the stats guy in our team. You're always the stats guy in our
Oh my gosh.
show.
The figures and the numbers are actually very worrying right here in Malaysia and all parts of the world as well. We're talking about this situation where everybody may not know that they have diabetes, right? So
Yes.
the figures goes up if you go and get yourself checked. So there are many types of diabetes. If I'm not mistaken, there are two. Type 2 diabetes and type 1 diabetes and so on and so forth. But we actually brought in a doctor right here to talk to us about it. But before that, the figures here in Malaysia continues to grow every single year and every single time. Back then in 2019, so the stats are 49% of the total figures. I'm not going to scare you with the figures. These cases are left undiagnosed. So with that being said, they just don't know that they have diabetes, and that is actually very serious because it can bring about complication. That's one. Maybe even death. Yeah.
Possibly.
So to talk about this, we brought in right here on set Dr. Teo Wei Leng, consultant endocrinologist from Sunway Medical Center, to talk to us about prevalence of diabetes here in the country.
Hi,
Hello,
Doctor.
good morning.
Good morning, Doctor. Thank you so much for spending your Sunday morning with us. I know it's a bit of a gloomy weather. You rather just stay at home.
Yeah.
But thank you for being here. And it's your first time on the show with us.
Yes.
Thank you so much
Fantastic,
for
Doctor. Yes.
Yeah. So, Doctor, as Brandon was mentioning, type A, type 1, type 2 diabetes you were mentioning, and the number that he also stated as well, 49% based in 2019 that you mentioned. Is that true, Doctor? Or
Yes.
what is your opinion on that?
So first of all, talk about the different types of diabetes first. So we've got two different types of diabetes, as you said, type 1 and type 2. But in Malaysia and around the world, majority of the diabetes is type 2 diabetes, which is associated with what we know as obesity and physical inactivity and things like that. Yes, the statistics are quite worrying. So let me put this into context of the world. Okay, so the IDF, which is the International Diabetes Federation, says 1 in 10 adults worldwide has diabetes. Majority, more than 90%, type 2 diabetes. But that statistics, 1 in 10 is around the world. In Malaysia, we are at the level of about 1 in 5. So 1 in 5 Malaysians have diabetes. So in 2011, 11.4% has diabetes, which is about 1 in 10. But in 2019, that National Health and Mobility Survey that you were talking about, the figures are that it's gone up to 18.3%.
Right.
So that is almost like a 68% increase in people who has been diagnosed with diabetes.
That is indeed worrying, isn't it, Brandon?
Very worrying. But honestly, where did we go wrong in this? Why are we suffering from this unwanted situation, this unwanted stats and all that?
Well, as you have mentioned earlier in the program about celebrations, so in Malaysia, food, yes. So in Malaysia, we've got Chinese New Year and Hari Raya, Deepavali, and all sorts in between.
Okay.
We've always got reasons to celebrate. We socialize over food. Food is our love language. So there would be rising trends of obesity in Malaysia. And Malaysia, Malaysia boleh.
Yeah.
We are the fattest nation in Southeast Asia.
That's true, Doctor. Talking about Malaysia and food.
So, Doctor, you spoke about the different types of diabetes, type 1 and type 2. And the reason why this unwanted thing happens to us here, right, in Malaysia. So we talk about food, right? Malaysia, you have a reason to celebrate each and every single time. But we are not saying you cannot eat.
Absolutely. I mean, what you said earlier in the show was absolutely right. I mean, it's not all doom and gloom for people who's got diabetes. So it's all about balance. So if you knew that there was a big celebration coming up, okay, be good before, have your celebration, and be good after.
There you have it.
Yeah, so going to the gym and all that will definitely help.
Nice.
But Doctor, I want to ask as well, because I've also had instances where I've had friends or people that I came to know of, who are very young.
Yes.
And they got diabetes. And even from, I would say, babies as well, right? Like, is it more of like a generation thing? Like, is it passed down? Or is it only that, okay, is because the mother, when she was pregnant, she ate a lot of sugar. How does this happen?
Okay, so just a little bit of so when babies are diagnosed with diabetes, so they would have type 1 diabetes usually.
Okay.
Okay.
Okay, so that is a, I suppose, autoimmune condition whereby the pancreas does not produce insulin. So it's
Okay.
different. It's different from our type 2 diabetes whereby we talk about food and we talk about physical inactivity. But you're right, over the years, I am seeing younger and younger patients being diagnosed with type 2 diabetes. Recently, I had a 17-year-old who had been
Oh my
diagnosed
God.
a few years earlier.
17, wow.
Yes. And our pediatric colleagues, our doctors who do children, pediatrics, they have been seeing type 2 diabetes in teenagers, which is very scary, and that's all because of childhood obesity. So I think moving forward, we really need to tackle the issue of obesity from childhood, so from school meals, growing up, so that children are aware what is healthy food, unhealthy food, what is a good lifestyle. Physical activity is important. Yeah. So we are seeing people with diabetes, type 2 diabetes, younger and younger.
Is it passed down by?
So family history is one of the risk factors for developing diabetes. Certainly, if you have both parents have diabetes, your risk would be about 50% of getting diabetes.
Just like that.
Just like that. But we can't change our parents.
Yeah.
Okay, we can't change our family history, we can't change our genetics. So we don't focus too much on that in that sense. I mean, if you know that you have got family history, then you'll be even more jaga your makan.
Yeah.
Okay?
Yep.
But obesity and physical inactivity is really crucial.
Yeah.
I mean, there are people who you talked about also, mothers who has diabetes in pregnancy. So for that woman, her risk of developing diabetes in the future is slightly higher. It's not that she passed on her diabetes to her child through gestational diabetes, but because she has gestational diabetes, her risk of developing diabetes is higher. Therefore, the child or children will have that genetic risk.
Right.
Yeah.
Right. So it puzzles me because when I hang out at shopping malls and all that, I see parents giving their kids carbonated drinks,
Yes.
fizzy drinks,
Yes.
ice cream at a super young age, right? I wouldn't say that is not recommended, but if you can, please, at all costs, parents out there, avoid it.
But it's given excessively.
Excessively is the word that we're using right here.
Yeah.
Diabetes knows no boundaries.
Yes,
It does not matter
absolutely.
how old you are, how young you are, you can get diabetes. But type 2 diabetes, is it reversible?
Well, it is reversible. When I was in medical school, it was not reversible. But of course, as times pass, we've learned more from research. And actually, diabetes in the first 3 years of diagnosis is high chance of reversibility. So really turn around your lifestyle, lose a lot of weight. So there are now people in the UK, they actually put these people with type 2 diabetes, obese people with type 2 diabetes, into a program to lose massive amounts of weight, and they are able to achieve a reversibility about up to 50%.
Nice.
So it's not all doom and gloom, but early detection is key to prevent complications and also to just have a better outcome.
Right. So when you mentioned about early detection, right? How does one know that they have diabetes, type 2 diabetes?
That's
Because
true.
it's actually, some people would say that this is a silent killer. You don't know that you have diabetes till the complication comes later on. Yeah. So
Yeah.
how do we know?
And a lot of people actually don't go
Correct.
with their medical checkup. I have to add that as well. A lot of people don't do that.
Yeah. When was the last you went for a medical checkup?
Quite a while.
There you go. Yeah.
That's why I have to add that.
Yeah, exactly.
So what is the key indicators? I
Correct,
guess that's what
correct.
we're asking.
Yeah, so unfortunately, diabetes at the early stages actually have absolutely no symptoms.
Yeah.
By the time you have your weight loss and you're feeling thirsty, dry mouth, going to the toilet to pee, and having visual problems, urine infection, the sugars are pretty high. So when you mention medical checkup, that's absolutely crucial. I mean, sometimes if you do go for medical checkup and you find yourself in the so-called pre-diabetes stage, you are considered lucky because you'll be able to do something about it. Rather than way past that stage and you come in with your first heart attack or first strokes, that, and sometimes some people know they've got diabetes when it comes to sort of a serious admission like that. So medical checkup, regular medical checkup is crucial. Maybe medical checkup can be expensive for some, but actually our local pharmacists, they offer a blood sugar testing for really quite low price, which is very accessible to everyone.
Right, okay. And yeah, like you mentioned, blurry vision,
Dry mouth.
Dry mouth,
you
yeah.
know, weight loss, excessive weight loss. A lot of people actually
Quite like that.
probably like that, you know, oh, I'm losing a lot of weight. They don't even probably think it's alarming
Correct.
to them,
Yeah.
right? So those are some of the instances, I guess, people at home especially, even us, we should definitely take a look out for. Doctor, you know, talking about all these, the symptoms, the key indicating factors and all that. So what are actually some of the complications that could actually occur due to diabetes?
Okay, so complications are divided into two groups. Okay, we've got microvascular, which is small blood vessels, and macrovascular, big blood vessels. So big blood vessels are like heart attacks, strokes, or poor circulation to the legs. Small blood vessels are to your eyes, so sometimes it can lead to blindness, hopefully not. Kidney problems and nerve problems.
Right.
So if you have good control of diabetes, even decades, you can avoid these complications. It's the kind of, I'm good for a while and then I'm not good for a while, you know, that kind of thing can sometimes lead to complications.
And the worst that could possibly
Worst would be,
happen
I mean,
for
of course,
people.
the horror stories that you hear from people is leg amputation,
Yes.
Yes.
you know, strokes that are debilitating, they can't walk and things like that. You know, blindness is one, dialysis, you know, these are some of the things that people, you know, the horror stories that people think about or know about or heard somebody of. So some of them are too afraid to get checked out. But what I'm saying is please get checked out so that you don't end up in these horror stories.
But would you say, due to advancement of technology and current medical sciences, right, would you say those risk factors that are very worrying, like you say, like amputation and all
Yeah.
that, can actually be avoided?
Yes. So with the advancement of technology, now everything is digital. We got WhatsApp, we got messages and things like that. So they've incorporated that into applications. You know, so it's like apps on your phone whereby you can take a photo, send it, you know, with your blood sugar, what's your insulin dose. So in Sunway Medical Center, we've got a diabetes care center which has an app like called Health to Sync, which you are able to do all that on sort of real time, and somebody will be able to respond as a chat function. Because sometimes diabetes can be very lonely.
Yeah.
You think you know, but you don't know. Then you Google said something else, you know, and you want to ask somebody. Then it's quite easy, you know. So advancement technology has really helped.
That
Nice.
one, Googling symptoms.
Googling symptoms.
Googling. It's
Don't
not an actual word, but Googling symptoms.
Don't simply ask Google.
Yes.
All
Google
right.
is not your doctor, guys.
Yes, exactly. It's not a doctor. Doctor, question is, right, what are some of the stuff that we do every single day might be contributing to type 2 diabetes?
And we don't know it.
Not just food, not just food, but maybe when it comes to drinks, perhaps, and stuff like that. So what are we actually doing that actually may contribute to diabetes? Rice?
Yes, so carbohydrate content. We are Asians, we grow up with rice,
Okay.
noodles. And if you look at your plate, so let's say a plate of nasi lemak.
Okay.
Our national dish.
Oh,
right?
man.
One center is the nasi, there's a little bit of anchovies and kacang and timun and a quarter of an egg, and then maybe or maybe not a lauk. Some
Okay.
people have lauk, some people no lauk.
Yeah.
But that plate of nasi lemak has got about 80%, 90% carbs. So that is the problem. So we need to think of our plate like a suku separuh plate. Suku protein, suku carbohydrate, and separuh sayur, vegetables. But again, the National Health and Mobility Survey say that 98% of Malaysians do not eat enough vegetables and fruits.
A lot of people
lah,
don't
doctor.
like the greens.
We are getting personal here.
Yes.
we're directly attacking Brandon here. But Doctor, based on what you mentioned as well, right, we also understand that Sunway Healthcare Group is actually having a no diabetes campaign, which I believe what you just mentioned is also one of the initiatives that you're looking to, I guess, convey through the campaign as well. So can you just tell us a bit about the campaign? What can the people at home, our audience at home, expect from the outcome of this campaign?
So, No Diabetes campaign is KNOW. So, we want people to know about diabetes. Okay, it started off in 2021 in the pandemic, whereby we did webinars. And 2022, we did a booth in Sunway Pyramid to offer BMI checks and blood sugar checks. But this year, we've decided that we talked about risk factors earlier. So this is a risk factor calculator of what your risk is of developing diabetes. Okay, everybody's journey or life is different. So this calculator asks very basic question about yourself, some history, and finally they'll count your risk, and we put it in a kind of like a red, yellow, green kind of thing.
Okay.
To let you know what is your risk. So some people might have low risk of developing diabetes, and some people might have high risk. And people who are in a medium to high risk, I recommend that they get it checked out. You know, they may not have diabetes. It's just an indicator for you to like just nudge you towards getting checked out.
At least the awareness is there, right?
Yes, exactly.
So that is actually great because, just go and get checked. I mean, you never know. You might have diabetes. Just get it treated out, especially if you have type 2 diabetes, where it's actually reversible, right? So the ministry, the government, they are doing lots of stuff to make sure that we are properly safe right here in terms of how we can upkeep ourselves better. We talk about cigarettes, Generation Endgame, where it's going to be debated in Parliament and stuff. And they also have this initiative by the Ministry of Health, 9.25% drop in consumption of sugary drinks after the sugar tax was implemented a few years ago, right? So what's your opinion about this? Do you think it's actually working?
So the government has introduced this so-called sugar tax on pre-mixed sugar sweetened beverage. So that's quite obvious. So your beverage in a can or a carton, they have got some sugar tax in it. But our mamak, whereby we have our tea and then our condensed milk and our sugar, that's not taxed. So, you know, we should move towards more taxation on sugar to sort of reduce even more our sugar intake. But of course, again, I think education is key.
Yes.
You know, we need to have awareness and starting from young. Starting from young.
Definitely starting from young. And don't we just love our mama?
Yes.
We do. But we need to move away from that. We can't wait for someone at the end of the door or at the end of the hallway with the rotan telling you what to do, right? So with tax and all those kind of stuff, I think what should be done is it boils back down to you and it goes back down to you.
Right.
To know what's right and to know what's wrong. To consume sugary stuff when you can and when you should put a stop to it.
And of course, when you should also consume vegetables.
I love my vegetables. What are you talking about, right?
Really, Brendan. But doctor, you know, I would say any advices, especially for people out there who may or may not know they're actually, they have diabetes, or maybe they know people who do. What can be done or what they should do starting from home?
For people who are thinking about it, I want to say to them that don't be scared. Okay, it's better to know than not know, because there are treatments, there are lifestyle changes that can be done to make things better for them. Okay, horror stories, we've heard many of them, but not everybody will end up that way. So early detection is key. We need to look into our food, carbohydrate content, key. We need to think about exercising, and often people will say, I don't have time to exercise, doctor. I go to work very early in the morning with the jam. I come back late at night because of the jam. But what I say is try to incorporate it in your lifestyle. Take the staircase, walk, park further, you know, so that you do have some steps in. You know, so simple things. We say exercise, but actually we just want them to move, because we are not moving much these days with the phone and the computer.
That's true, doctor. I mean, it's not just about, exercising means I have to go out, I have to spend 1 hour at the gym, 1 hour just to go jogging.
Correct.
You just incorporate in your lifestyle, like how you mentioned, you take stairs to go up. Maybe if you're living in the 40th floor, I wouldn't advise it.
Why not?
Okay, why not?
Yeah, why not? But you know what, doctor, thank you so much for being on the show.
Thank you.
For sharing with us all the insights about diabetes and what we can do to be healthier, you know what I mean? Yeah, to actually take good care of your sugar. Yeah, so
thank you,
something
doctor.
very
Thank you
freaky,
very much.
But yeah, we can do better.
So thank you so much, doctor, for joining us today.